My name's Diane Kerr and I have the privilege of being an auntie. I'm an elder of the Wurundjeri people, and this part here is the traditional country of my grandmother, mother and ancestors, and the health service has always been on my country, so connection has been about 40 years. The reason I like coming is because I feel welcome. I know I can come in here, have a cuppa if I need to, looked after as an elder, and if you've got an emergency, you can just come in. You don't have to have an appointment like a normal doctor you go to. And when I leave, I know that I have my medication, what I need to do. If there's other specialists I need to see, that's all done before I leave. So everything's complete and I don't have to stress when I get home, because I do live quite a way, about 40 k's I think. But I don't think twice about coming in here at all, because I know I'm welcome.
The Victorian Aboriginal Health Service was established by a lot of the community members well over 40 years ago. Those community members identified a need that a lot of the Aboriginal people who are based around the Fitzroy area weren't fulfilling their health needs by visiting the doctor or going to hospital. A lot of it was based on fear of going to the hospital. The fear was that you would never come out, and a lot of racism incurred by health practices around that time. Then they established a culturally safe environment, healing place for Aboriginal people, and by working hard and together, and a lot of volunteering, they managed to get a small building with a doctor to start the Victorian Aboriginal Health Service, which has grown to what it is today. At this stage now, the Victorian Aboriginal Health Service has well over 7,500 clients, and over the last 12 months, 3,500 people have walked into this service to receive quality of care.
The most important thing about Aboriginal community-controlled health is the community has control over their own health and their health programs that they run. They basically give me the mandate to provide those services. Aboriginal Health and Aboriginal Hands shows that we can actually do it. If you look back to before I was born, we had Aboriginal women having babies on the porches of hospitals, and now we've got pretty much equal rights everywhere in the country, but we still do it as Aboriginal people. We might not be funded the same, we might not be given the same aspects in life from school age when you're at school, but now we do it. Aboriginal community control and Aboriginal health is our business, and we do it bloody well. We are the experts in our own health. We don't look at the person who walks in with a broken arm. People who walk in look at us and say, we need help holistically. I might not be good at home, so we look at that. The doctors just don't look at the injury. So for us, the preventative stuff is really, really important. We won't close the gap without Aboriginal health in Aboriginal hands. We are far more important than that.
Hi, I'm Nicholas Dempsey. I'm from Cairns, moved here to Victoria, and now I work at VAHS as a dental assistant. I did my Certificate 3 training through the Royal Dental Hospital, achieved that 12 months training, and now I've got the opportunity to work here for an Aboriginal organisation, and I'm loving it at the moment, so it's good. I haven't had the opportunity to work for my people as much as I wanted to. I've been given the opportunity, so now I'm in this organisation, and now I'm looking to further my training. I want to do oral health promotions, which will take me out to the Aboriginal communities. There's not many promoters out there for oral health. As an Aboriginal person, it'll be a lot easier for me because I can get to know my people as easy as I can. Yeah.
Some of the particular challenges are about the way people experience and access health services for all sorts of historical reasons, and lots around trust and a lack of experiencing safety in a lot of the universal or mainstream services. I think it's really important to have a place where Aboriginal people can come that feels familiar and safe, and where there is an excellent standard of healthcare. So as well as being a community gathering place, it's also, VAHS is a place where Aboriginal people have access to a really high standard of healthcare. And by that I mean medical services, so primary health care and GP services, but also a wide range of other medical specialty services. So we've got paediatricians and psychiatrists on the staff, and we have visiting cardiologists, dermatologists, ophthalmologists, ear, nose and throat, service geriatrician, gynaecologist. So having that range of medical services available in a setting that is culturally comfortable for people, welcoming, means that people are much more likely to attend, and they do.
My role here at the Victorian Aboriginal Health Service is screening patients, getting to know them. I love to ask where they're from and let them know where I'm from. I do a lot of dressings, you name it, whatever happens in that treatment room we have to deal with, we have to do. We work with a doctor in the morning and another doctor in the afternoon, but whatever comes through that door we must do. And that's the best part about working in that treatment room. And we do bloods, we do plasters, we do, like I said, dressings. I love doing dressings. If I can stop someone's pain, that's the best part about it.
Hi, my name's Daryl Smith. I work at the Aboriginal Family Counselling Service, the Kuru Kids section. I've been there 10 years and yeah, it's a bit of a challenge, but I like working with the kids. I feel as if I've got something to offer the younger ones of today, and probably one of the main things I'd like them to do is learn to say no. No to drugs, no to domestic violence, just no. And pass you over to Rewai Wilson, team member.
Good day, my name's Rewai. I'm one of the counsellors in the Kuru Kids team. I'm qualified as an occupational therapist, which pretty much means I like to have fun with the kids and have a bit of a chat with them, talk about how things are going, talk about school or family or how things are going with friends. Like to play games and sort of hang out with young people as well. Sometimes we make some food.
For the last 7 years I've been manager of the community programs. That's the HACC Allied Health team, and we work with the active service model approach, and that's working with the client, not for the client, and helping them to achieve their goals. And we have elders, I think a couple of the age groups, 80, 94, do an elder circus today as we speak, and that's the real circus, so climbing up ropes and yeah, so we've got a good bunch of elders out there, and we try to have an elders yarding group for the ones that don't want to do physical activity, because not all want to do, you know, gym or hydro. They might just want to come together and yarn. And that's what VAHS is. It's like a meeting place. I've seen a lot of interstate people just straight away they come to VAHS. I'll meet you at VAHS, and yeah.
We were one of 60 teams nationally working on reducing smoking and increasing physical activity in Aboriginal communities. We've done some amazing work. We've been entering teams into fun runs. So we started off with about 15 participants, and in October we had 278 people participate in a fun run. So it's been amazing, that aspect of our work. We've also been working closely with a range of Aboriginal sporting clubs and organisations to implement smoke-free policies. A document about Aboriginal community control that my auntie actually wrote, and it was really interesting because one of the points in that when you talk about community control is about participation, and if you want to practice community control effectively, then you have to look at how you get people to engage and participate in your programs. And it was comforting because I think that's one thing we've been able to do, is that we've been able to engage people in health. And the other great thing about our program is that we're not focusing on people who are unwell, so we're working on people who are well, and we're working at extending their health, and we're promoting health and we're promoting wellness, and we're not just looking at Aboriginal health from a sort of deficit model of how sick we are. We're looking at, look at us, look how healthy we are.